I'd like to introduce Hazel from Ireland, who takes LDN for Crohn's disease. Thank you for joining me, Hazel.
Okay.
Could you tell us about your Crohn's disease when you first started to notice symptoms?
Oh, yeah. Well, it was it's a good bit ago now. It's about 15, 16 years ago, and I was actually, just prior to being diagnosed, I had been travelling in Asia with my husband. We had been married just recently, so we decided to move to Australia. So we went to Asia for 3 months, and it was glorious. But as soon as I landed in Australia, I started getting very mild symptoms. But my brother-in-law, who is a doctor, said, "Oh, you better go to a doctor to be there's something wrong,
Mm-hmm.
So I was diagnosed originally with ulcerative colitis, but it was extremely mild, and I was fine for about until about 3 years ago. So I had a good spell of being excellent. I mean, I had very limited disease, and I couldn't relate to anybody who was sick with inflammatory bowel disease. But my daughter was diagnosed after being sick for about 3 weeks. She was diagnosed with Crohn's about 3 years ago, and it really affected me, and I just had an absolutely huge flare, and I actually didn't know what was going on because I'd never experienced it before. But I was extremely sick by the time I got to hospital, and I spent about in and out of hospital for about 2 months. It was just terrible.
Goodness.
Yeah, it was absolutely terrible, and eventually I got it under control, but the whole treatment nearly killed me between the steroids and every single drug they gave me, and I just went from there. I kind of, plodded along for a while and started doing some research and came across a diet and things like that. And eventually I got around to actually doing a diet, and it was actually when I was on the diet, a specific carbohydrate diet, I actually started coming across people who were taking this drug called Low Dose Naltrexone. And I didn't do anything about it at the time. I was kind of concentrating on the diet, but it just kept on coming up in Google searches and in people's posts about inflammatory bowel disease and LDN. And I just said, I'm just going to really try and get this, because I did so much research on it.
Mm-hmm.
And I just thought, I really wanted to try it because, I wanted something to give my daughter, because she was on immunosuppressant, and I was really anxious to get her off it. And I just felt that anything I do, and if it works, and if it's got little or no side effects, it's something to give my daughter as well. So it was kind of like a mission I had.
Mm-hmm.
So I eventually got LDN, and I started it about 10 months ago. So I've been on it since with a diet, and I'm absolutely perfect. It's been brilliant. So I've been absolutely thrilled. It's just really turned my life around. Now, I wouldn't use LDN really as such on its own, but I do use it with the specific carbohydrate diet. But I do think it helps, because I was extremely sick. I had another flare after the first one, and I was very sick again, and I just decided I have to do something. So I'm a year and 3 months now down the line of the diet, and using LDN for 10 months, and I really, really have not looked back. It's been fabulous. So, so it's been great.
Did your own doctor prescribe the LDN for you and your daughter?
Oh, I had to ring a pharmacist in Galway that compounds it, and it's in Gort in County Galway. I can't remember the name of the...
Brendan Quinn.
Quinn.
Yeah.
Yeah, and they actually put me in contact with a GP that is about 3/4 of an hour from me. It's the nearest GP I could get who would actually prescribe it. Unfortunately, my own GP wouldn't do it. She never heard about it. And my consultant refused as well. So I decided, well, if they won't give it to me, somebody else will have to. So I actually got it from Dr. Maeve Bradley in Macroom. She actually uses it for fertility. She has a fertility clinic.
Mm-hmm.
And she was great. She had no qualms about giving it to me, and she knew all about it, and she's having great success with it, she said. So I just said, this has to be tried. So it's been brilliant. It's been great. And I get it from Skip's Pharmacy in America.
Okay.
So it's it's really good.
And how about your daughter? How has she been?
Yeah, she's been fine. I'm just one of these people who does believe in diet restriction for Crohn's. I mean, it's a digestive disorder. I just really, from the research I've done, I just feel that diet really does help. So she's been really well, and you know, they were quite negative about her too when she was diagnosed. So it's been great. It's been a great relief to see her well, and she's growing. She's tall, and she's had no problems really through diet. And I'm hoping long term now with LDN as well. She only started about 4 months ago, really. So we're still going with that. But it's great because she was getting headaches from the immunosuppressant. And just long term, I would be very nervous about leaving her on it. Whereas with LDN, it's just perfectly safe. There's no toxicity. There's no, you know, it's just such a mild drug compared to what the standard treatment for Crohn's, you know.
What dose is she on?
She is on 3 milligrams, which is what I take as well.
Okay.
And
you also said your son takes LDN.
yes, he does. He's got really bad allergies. It just started off as seasonal allergies, and it just seemed to keep on going, and it was getting worse, and he would just have it during the winter as well, just wake up and his nose was streaming, his eyes were streaming, sneezing or coughing, and sometimes it would go to his chest. And we tried just so many things, you know, and this year he has his junior cert. So I just felt, oh, he can't miss school the way he did last year. So I decided, after trying lots of things, I decided, you know, LDN, you know, could work for him too, because it does work on the immune system, and it's obviously an immune response he's going through. And it's been brilliant. He actually has been really well. I still give him supplements. I give him strong vitamin C to keep, you know, just for his immune system. But he has been great. He has not looked back either. He's had no attack now in a long time. He will still get a slight, every now and again he'll get a very slight kind of a runny nose or whatever, but nothing compared to what he has. So it has definitely worked for him, because I suppose out of all of us we can see that it's worked, because, you know, he was constant. Every week, every 2 weeks he'd have an attack, you know. So he hasn't had any major attack since he started it. So,
well, that's amazing, isn't it? The LDN family.
Yeah. Yes, I know. Yeah, I do think LDN is helping a lot. You know, I think it's really worth a try for anybody who's got a chronic illness. And I mean, it has no side effects. So, and it's quite reasonable too if you can get it. Well, we're in euros here in Ireland, so I get it from America, and the dollar to euro exchange kind of helps as well. So yeah, it's been great.
Well, thank you very much for sharing your experience with us, Hazel.